Instead of our regular show, Confession of a Futurist, we are talking about more pressing issue today, that is COVID. We all know the challenges, what's happening in India. The situation is really scary. A lot of challenges we have in front of us. And the conversation I want to have today is slightly different. It's not just about India. The global population is 7.8 billion people. And we haven't vaccinated even 10% of the world population yet. And we are talking about herd immunity today. We are talking about as if we are out of COVID. What's happening in India? What kind of new strains are happening? It's a huge challenge, and our scientists are figuring it out. Even, I don't want to scare anyone, but even the vaccine from Pfizer, people are finding it may not be effective, and they are finding reason if it's underlying reason or there are some other issues. I have invited a very special friend of mine, Krishnan, today on our show. Alan is an industry veteran, more than 4 decades of experience. He is IIM Bangalore, right?
Yes, sir.
Bangalore graduate. Phenomenal person. You can look him up. You can find more information about him. But one thing I want to tell you, he is one of the true go-giver I have met in the last 1 week. We met 3 days ago, and I said that we are working on it. We want to help India. We want to really help India breathe. And he said, what do you need? I said, we need people who can donate and we can help our nation in India. He has arranged within 24 hours funds to ship 200 oxygen concentrators, and it's already on the way. We are keeping our fingers crossed. Hopefully it'll be there next week, Alan.
Hopefully, yes.
So Alan, why don't you share a little bit about what you think? Where are we heading? What is the problem? Truly, what is really the problem? And how do we deal with current scenario?
Problem is that we don't know. And a lot of people have knee-jerk reactions. Sadly, from the highest powers in the world to the lowest common man on the road. I believe the only people who know anything are the doctors, and we need to follow what the doctor instructs. And the very basic thing is simple. If you leave your house, please wear a mask and a shield. I have not stepped out in the last 14 months, and I spent 5 of those in India, without a mask and a shield if I'm not in the protection, safety of my house and my car. I have traveled across. I was in Chennai. I traveled to Bangalore in a private car. I caught a plane to Paris. From Paris, I flew to Atlanta. From Atlanta to DC. I stayed in a hotel. I stayed in an apartment for 2 weeks in quarantine before I came to my own house.
And you are vaccinated, right?
Well, I'm vaccinated now, but nothing has changed. The fact I'm vaccinated is irrelevant to me because it only means, God forbid I get infected, chances are I won't be hospitalized. If I'm hospitalized, chances are I will not die. Nothing is guaranteed. My vaccination does not prevent me from being a carrier and infecting somebody else I meet with. I still do not leave my house without my mask and without my shield. If I'm in my car, I still have the mask on my chin. And the moment I step out, the mask is up and the shield is up. And without that, I do not go anywhere. And I think if everybody followed this, the world will be a better place.
I think, Alan, the problem is even bigger than that. The reason problem is bigger is we live in Western society, we live in Western world. And the standards, we are all privileged. Every single person living in America is privileged that they have access to vaccine and people are not taking vaccine. And I talk to a lot of my doctor friends, even they are finding their own staff is not ready to take the vaccine because they are concerned about some of the challenges or the issues we have faced with certain vaccines. I don't want to name any of those because these are all medical science and the challenges we don't know. Nothing is perfect, unfortunately. So we are not getting to herd immunity status or stage. We had Vivek Murthy a couple of days ago, and he talks about it that America is far from herd immunity. 30% of the American population won't take vaccine no matter what. And I believe the number currently is what, 35%, Alan?
Somewhere in that range, yeah.
But the global
About a
population,
third.
we say it's not even 10%. So the challenge I really see it is people are really looking at India saying, oh, how bad is there, how big of an issue there is. We all know what was happening here in Los Angeles and New York. It's not 10 or 11 months ago. And people have such a short memory. And that's where I'm having a lot of concern. And you are talking about taking basic hygiene and doing basic things. So question I have is, how do we prepare a better world, a future world? Because that's what we want to talk about. We are going to add 3 billion more people in next 20 years, maybe less. And they are coming. And this health issue, what we have at our hand, in spite of the best technology out there, in spite of mRNA or DNA and all the research we have done, we are not able to control it. So what is the solution? We can't isolate ourselves. We can't completely close ourselves in our homes forever. So what's your take on that?
I think the future is bright because by and large, the younger generation, the teenagers, barely out of teenagers, they are very conscious. They wear their masks. They make sure that they keep their safe distances and the rest of it. I think they are not taking anything for granted. I know many young people who control their parents and make sure the parents behave and toe the line. I think it's all about education and compliance. Certain things, there is nothing that can help you. So we need to spread the word. And somebody thinks they can violate, then they face the consequences. Right now, I'm having a death every 3 days. Somebody I know closely is dying every 3 days. It's terrible. And these are people who are very careful, and still that is happening. So people who are careless, the risks are too high. And right now, honestly, we don't know what's going on. We just have to be careful and protect ourselves. And then we have to educate people. Tell them nothing is wrong if you have to wear a mask and follow some basic precautions. And
so let's talk about technology, Alan, because we both come from technology world, and you and me talked about 110 volt and 220 volt devices. And there are people who are still shipping 110 volt devices. So what measures should they take when they are shipping these devices for their loved ones?
See, this is a very good question, Edith, because it's incredibly important. A good friend of mine who's a cardiologist in Maryland, about 10 days ago, she wanted something for an aunt. So she bought a 5 liters per minute oxygen concentrator and sent it out. And I said, but it's 110 volts. Oh yeah, they'll get a 220 110 step down. In India, it's easily available. Problem is, many of these step downs do not run for more than 2 or 3 hours at a time. You need this to run 24/7. Second, it's not just voltage, it's also a matter of cycles. So I have a good friend of mine who's one of the leading transformer manufacturers in the United States. I asked him, what can you do about this? He said, well, the biggest problem is your frequency. The ones in the United States is 110 volts, 60 hertz cycles. The one in India is 220 volts, 50 cycles. The voltage comes down, but the 50 doesn't change to 60, and therefore your supply of oxygen is very questionable. I spoke to a manufacturer in Pennsylvania, in Philadelphia, from whom we are buying about 432 of these units. And he said, I won't sell you 110 volts for export to India because it won't work. So the answer is this: you need an inverter. So essentially what happens is your 220 volts at 50 cycles will be converted to DC. And the direct current will then be inverted and changed into 110 volts, 50 cycles. This is what people need to look for and find it. These are available, and that's what they need to use. And that would give them reliable supply, because effectively you're changing the electricity to what is available in the United States. Now, 5 liters is the minimum which needs to go, and by and large, that's okay for home care. If somebody needs 10 liters, they probably need to be in an ICU. That's what is expected. That's a conventional wisdom. But it still makes sense to send the 10 liters for 2 reasons. One, it gives you more consistent, guaranteed supply of the 90, 92, 93% purity of oxygen. Second, God forbid, there is a second patient in the same house or neighboring house, they could potentially share the device.
Yeah.
And the marginal price difference is about 50% between 5 liters and 10 liters. So between the benefit of using it in more serious cases in an ICU and sharing, it really makes sense.
Yeah, but Alan, we are sourcing for IIT Delhi right now, and we are sending these next week, these 500 plus units. The challenge you and me find it is we couldn't find any supplier who can give us 10 liters. We look for it. And I even found a manufacturer. People want to talk about China, but only in China you can find manufacturer nowadays. And they have offered to make 40 a day. And if we place the order and pay them upfront. The challenge is this looks like a very simple device. It's just some geolite, some motor, and it just air is passing through. It's a filter. I mean, I can send the diagram. It's a piece of cake. When you look at the diagram, it's how complicated it is for a 500,000 of IT alums and millions of engineers globally. It's a piece of cake, but it's a medical grade device. You can't just do that. You can't provide something which is just good enough. So there are a lot of open source design and people are talking about that. So did you find any credible design which people can use and make it at their home or not? We are not there yet.
Making in the home, I don't expect ever be there. This is a matter of life and death. I'm not even willing to trust the step-down transformer. There's no way in heaven we can do anything at home. Now, much as I hate to depend on one single source, unfortunately, at this time, there is only one single source largely that we can go to, and that is China. I do have a manufacturer in China who's offered me 10-liter units. He wants me to buy 500, but I'm scared. Number one, I don't have $500,000 to buy it at this point. Second, I don't know how it will work. So they have agreed to give me a test shipment. And so I'm having an order now for 12 units, which I'm going to ship to Bangalore. We're going to distribute it around, test it. Hopefully it will work. 2 of them is going to IIM Bangalore, where they're going to set up an emergency care center, and keep fingers crossed, and hopefully it will work. And I think we have to jump into water if you want to swim. And that's why I'm buying these 12 units, about $15,000 to get it there and distribute it. And I think it will prove the concept, whether it works or not, and then we work on good faith and it will work. Awesome. I think we are very far from making anything at home. It's not going to, we don't even think about it.
So now there are a lot of talks, and I even shared with our audience yesterday around the oxygen generators and converting nitrogen generators to oxygen generators, because the nitrogen plants are very easy. Every single, pretty much any place you need cold temperature, you have nitrogen generating.
I did find one supplier who's willing to give us oxygen plants.
Yes.
For as little as $110,000.
Oh, wow. That's
and
really
nice. It can be put up in as little as 3 weeks. And there is not that much demand. So if there is a hospital or any major temporary facility, including a large hotel which has got the rooms, we can install it there and have a 200, 300, 400 facility and connect it up to everybody.
So how many cylinders can it fill, or what is the supply?
I don't have exact numbers, but it can easily, I believe, within the first week's production, it can cater to 200, 300, 400 beds, and then it's a matter of replacing it. So it's very viable.
Replacing means economical. Like what needs to be replaced in that case? Is the zeolite membrane needs to be replaced, or the tanks?
No, the tanks have to be reused. So the tanks will be used and then empty and refill and so on. So that's just a matter of capacity. Right. And in India, yes, oxygen tanks may be a little bit difficult. But then we have plenty of the regular conventional gas cylinders. And I'm sure if you purify them, clean them, you can always use them up for your filling up with oxygen and so on.
Yeah, the challenge we have with that, not to interrupt your thought, Alan, is we talked about it, but the way those connectors are, those are not designed. So you have to change a lot. It's not that trivial. That's the problem.
Right.
It's not just the cleaning, it's the whole... the system needs to be changed, mechanism needs to be changed, which is the complex thing.
Correct. So there are challenges, definitely, yes. And most of these machines are good, they say, for 10,000 hours before they need to be serviced or anything. Wow. So they should last for a year without having any serious immediate necessities. And God willing, in that time, we will be more stable and we should be able to do a lot better than what we are doing now.
So is there any message and appeal you have for our audience, or you want to share with them what you are doing personally or on the ground, because you are in Maryland and I'm here in California?
Well, I would say across the country, there is tremendous impact. In fact, I just got a message today from a physician in the UK saying, hey, can you get me one cylinder in Bangalore? I'm desperately in need of one. So I think every one of us should join forces and join groups, and the groups can do something. We are unfortunately competing with each other instead of consolidating. So everybody sadly is being opportunistic. I'm not necessarily faulting them, but reality is this. Everyone is trying to make the most amount of money they can. So the manufacturers change prices. Like these 10-liter units, I had a contract, not a contract agreement with them, quotation from them at $800. They just increased the price this morning to $950. I'm not arguing, I'm just paying it. That's $1,500, $1,800 extra. In percentages, it's ridiculous. It's 20% price increase overnight. I cannot guarantee I will get this 10 days from today, because even the raw material components they need, those prices are also going up. So it's totally demand and supply. So at this point, I would say common wisdom is please don't duplicate efforts, join groups and provide whatever you can, you're able to, you're willing to, and then you can negotiate with manufacturers. There are manufacturers in the United States who make 110 volts. They are capable of making 220 volts. Use your good offices and beg them to make more. And what you buy in the United States will be unquestionably world-class. There's no question about it. So we can do that. There are manufacturers in India who do a good job. Identify some of them and support them. Maybe we can send them raw materials from here, which is not available there. So I think as a group, we should do that.
I completely agree with you. We have to join hands. And that's the reason I reached out to everybody, including you and different groups. And there are a lot of groups are working with us right now, not only for fundraise. We are helping every group, whoever needs it, as long as they are non-profit, to facilitate it. I got access to another 2,000 units. So there are inventories available. Of course, cost is an issue and it's going up every single minute, as we know. So Alan, we have a few more minutes. I want to talk about a little bit about remote places. So we talked about New Delhi, we talked about Bangalore, we talked about all other places. What's happening in the villages? Is this a problem there, or these people who lives in villages, they are kind of isolated with that?
No, sadly, the problem has gone everywhere. And it's rampant in places where you don't expect it to be, like Nasik in Maharashtra. It's an important place because India's security press is there, but it's a beautiful place with open spaces, agriculture, and things of that kind. They're saying it's terrible. I was talking to somebody, he says it's miserable out there.
Wow.
3 days back, one of my employees from London called me and he was sobbing his head off because his mother is hospitalized in a remote area. There's no hospital space. Fortunately, his wife's family has a health center. She's there. He has some relative who manufactures oxygen, so they've got a cylinder of oxygen. It's horrible. It's spread across. There is no safe place. And unfortunately, at the risk of being repetitive, everyone has to take maximum care of themselves and prevent themselves from being a problem. Because if you get infected and you die, it's your problem, but you're being a problem to society and stressing out the resources.
Not just that, Alan, I'm finding interestingly enough, and a lot of people are asking this question is, why aren't India putting the quarantine rules all over? Why aren't cities, states, country is shutting down the way it was in last year, March, April? So what is your take on that?
See, I was in India last time when the shutdown happened. First, just for one night, one day, 1 week, and it kept going on and on. It was done by the central government. And I think, unfortunately, there is experience and political interests that the central government just said, hey, Indian states, you're the local guys, on the spot, you do whatever is best. But end of the day, I am not going to count on the government to save my life. I need to save myself. The government did a lot. Even then, people violate the rules and go. Even the White House. We had events in the White House when the US secretary, health secretary, and everybody said you got to do A, B, and C. They violated it blatantly. So ultimately, the blame lies at the individual. And there are people I know who are extremely careful. but they still got infected and some of them even died. So you don't know who's coming within your reach. It can be a vendor, it can be a housemaid, it can be anybody. Somebody said, oh, I'm going to the temple to pray. Next thing you know, he got it. Some other guy went to eat a pan. He just went, bought a pan and came. That's the only trip he's made outside his house. And he's infected. So there is no compromise. There is no anything available. Some of my best friends visited me 3 days ago. We sat across from each other wearing masks in an open space in my house, in the patio in the back, in a fence-screened porch. There is no compromise. And we cannot point fingers at anybody excepting ourselves if we get infected. I cannot blame Modi or Trump or Biden or anybody. If I get infected, I have myself to blame. Not the people who
our life is at stake. Our personal life, our loved one lives are at stake. And so we are requesting everyone to stay safe, stay home. We know things are changing even in America, and there is a very high possibility America will open completely or at least 80-90% next month. I'm not convinced personally that we are ready for that. However, we need to work together, work as a group, work as a team globally, and take care of all our brothers and sisters globally. It's not just about India, it's not about America. Think of Brazil, think of Mexico, think of so many countries we are surrounded with. It is very important, and we all have to take precautions. We all have to work together to eradicate this problem. I cannot stress enough, we are not out of it yet, and the problem is not gone. Yes, we are able to manage it with vaccine. Yes, we are able to save some lives, or at least we are able to reduce the infection, or we are able to reduce the severity of it. The problem is still there. And I consider myself a futurist. At this point of time, I completely feel helpless. So my request to everyone is, especially tell all your friends and family members in India and other countries, stay safe, stay at home, somehow manage it. We know it is really hard. It's a really tough time. Alan, do you have any parting thoughts for our audience?
Yes, my parting thought is again just this much, that if somebody gets infected and eventually they die, the rest of the family will struggle, they'll get along. But you are not phantom. You will not return from the dead. So please take care of yourself by protecting yourself, just for yourself. Unless you want to commit suicide, go to the Golden Gate Bridge and jump off it. It'll be much simpler and easier. I have friends who have been infected and they've said there's been nothing worse than going through COVID. Young people in their 30s, late 30s, they have said this has been miserable. So I would say, please, 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 wear your mask, wear your shield, and make sure you protect yourself. Nobody else can.
Thank you very much, Alan. Thank you. Thank you so much for your time, and thank you for your contribution. I know you are doing a lot. You are helping our cause and our nation a lot. I can't thank you enough for all the hard work you are doing and great work you are doing. It means a lot to me.
Thank you for the opportunity, and thank you, listeners of Radio Zindagi. Please spread the word. Keep yourself and your friends protected. Thank you.
Thank you, Radio Zindagi. You heard Alan. He is based out of Washington, D.C. He is living in America for a very long time. His heart still lives in India, and so many of us. Please pray for India. Thank you.